first ER visit often becomes the first thing the insurance company looks at to determine how serious your injuries are. When you go to an emergency room after a crash, one of the first things the doctors are trying to do is to make sure that there's no injuries that are life-threatening, bleeding, broken bones, etc. Many times they document those serious injuries but don't notice or take note of the problems that may bother you later. In fact, sometimes they may suggest things like denies neck pain when that wasn't true at all. And that's typically because they're trying to figure out what more serious injuries are and they may overlook that problem. Therefore, it's important that if you have ongoing problems after you're released from the hospital to make sure you follow up with your family doctor or any other doctor they recommend that you do. If you review your medical records following a crash and they don't match up with what actually happened or what kind of symptoms you actually had, it's important to make sure you bring that to the attention of your treating doctor so they can be reflected going forward what actually is going on with your condition and your injuries. Once the claim is started, you're going to want to have a copy of your medical records. And that includes the emergency room visit, because oftentimes that is a very important part of the case and the evaluation. You should look at those records to make sure they match up with your experience and is also the problems that you had from the crash. If you're dealing with an insurance company and need help protecting your rights, call us at 317-269-2509 for a free case evaluation.